Now His Excellency will unveil phase 2 of this bill. Tumpigie makofi tafadhali. Of the building that has been unveiled and some of the subjects that here and there.
How are you guys? Very good. Okay.
Alright, welcome Your Excellency. We have a smart class. The purpose of this is to help our students access our students and mostly it's because we have students who may have challenges to class and make sure that they can. The second thing is that we are empowering our students with the digital skill of learning how to even start up a project like this. And this how they are meetings the starting point to the innovation. Now, how does this work? There are features here. The features, these are physical features. It's very easy. Camera and 2 screens. One screen is for the ones that we use to teach. And then there are members of the class. So we have some white students there. And then the rest are sitting.
Who are remote?
Yeah.
The students are remote?
Yes, they are remote. So any that... Yes, it is a hybrid class.
Very good.
Yes.
Beautiful. Thank you.
Excellency, we are connecting our 4 universities to one consortium. And they have the same systems of IT.
Yes.
And they communicate and they utilize the teaching staff and they utilize
The resources they have.
each other.
They share.
And they share and expand. We work
This is where we're going to mention.
This is
The future, so that we only reduce the costs to control lecturers. For example, costing us too many things. We have this, we have lesser lecturers that you utilize the resources that much more.
Thank you. Okay, so which class is this now?
Now, this is a strategic management class.
Strategic management.
Yes. And we're currently going through FESTEL, political and economic
Political
social
factors.
Yes. So all these
Economic
factors, yes. Yeah.
Social, environment, technology, legal. Very good. Okay, so what are some of the political factors you'll be... Let's forget about the political factors. Let's talk about the economic factors.
I'm sorry.
My name is Kata Edinadana. A student pursuing Bachelor in Business Management. Business Management.
Business Management.
Yeah. Specializing in finance. And these political factors are how our government's actions and political stabilities affects the business organization and the economy at large. These political factors include the taxation policy, the government stability, the wars and conflicts. Like it can be the internal within our country or the international wars, like Russia-Ukraine war, how it affects our daily business activities. These political factors matters in our daily business activities because it determines the investment attractiveness. It also helps us to plan the daily strategies, like in planning in taxing plan, how you plan to start your business, such things.
So you take into account some of those factors?
Yeah.
Taxation, stability, predictability, that is the business environment.
Yeah, that's right.
Very good. Okay, and what are some of the economic factors that somebody else can tell me some of the economic factors you people are learning about?
Hello.
Hello, how are you today?
Fine, thank you.
Very good.
The economic factors,
I can't hear you.
the economic factors, it deals with everything related to the financial aspects such as the inflation, interest rates, unemployment, and many others. And this can also, mostly, the business cycle can affect them, such as from many business, how it adapts from the peak to the trough, the recession, and the expansion. For example, a company can find ways to
mitigate some of the, because I would say inflation is a factor.
Yes.
Is an economic factor.
Yes.
Interest rates.
Yes.
Is an economic factor.
Yes.
That inform how businesses thrive, or how they succeed, or how they go through challenges.
Yes.
Yeah. So like our inflation has come down from 9.6 to about an average of 4. Is that good or bad?
It's
Interest rates have also come down from an average of 18 to about an average of 14. Is that going in the right direction?
well, yeah, it's going in the right direction.
Okay. Hello, how are you? Very good. Hi, how are you? Hello, how are you guys? Very good.
Umma Innovation we create, innovate, and also include future entrepreneurs. We have 3 key projects that we aligned to the government agenda in health, agriculture, and affordable housing. Welcome.
His Excellency, my name is Nora Kasim. I'm an undergraduate student taking Bachelor of Science in Nursing.
Hello, Nora.
I'm part of the innovation team at Umma, and me and my team came up with digitizing the mother and child healthcare book. When the mother and child healthcare book gets lost, we lose a lot of data, the previous pregnancies data, which we can use to prevent losing lives of the mothers. Now, the mother is able to track her pregnancy process, the next appointment, and this can be, she can get a reminder from her phone of the next appointment so that she will not miss. Then we have the pregnancy journey she's going to track in her first trimester, what she's going to experience. Then we have the care. This is where she can track and get it. After many years, she wants to know the immunization schedule of her child. She's going to get it, the ANC. Then the symptom risk assessment, I used AI, I integrated AI. This tool does not provide medical advice. Always consult with a healthcare professional, but she can describe her symptoms. And this is an example of a risk assessment, and it told the mother she's of high risk. The recommended referral was to, I gave Kajiado as a location. So given your location and the agency, please proceed to the nearest healthcare facility. Then locate care, find a hospital within your area, and also find a transport. In terms of emergency, you should also be able to find a transport. Then community forum, connect with other mothers and healthcare professionals. They're able to discuss upcoming things. Then upcoming blood drive, she's able to know of a blood bank. Donate blood, save a mother, and no mother should die while giving birth to a child. And we end PPH. So learn about the SHA, the government, new health financing programs under the government, the Social Health Authority and the Linda Jamii. Then the healthcare worker portal is able to get real-time data about the total mothers registered, LC visit, high-risk pregnancies, and we can able to make predictions and predict the maternal mortality rate. Then this app is also, not every mother has a not everybody has access to smartphone. Then we have a USSD simulator. If a mother is...
You have a USSD simulator?
Yeah. She can either choose a language, English, Swahili, check her, she can use AI to check her symptoms, find a hospital, find emergency driver, and get the ANC schedule. Yeah.
Very interesting. That's good. Am I allowed to ask a question?
Yes, sir.
So, we now have our healthcare program, you know. The SHA program is now digitized.
Yeah.
Admission is digitized, the whole process is digitized, including discharge.
Yeah.
And the whole program also around what you just described, maternal care, you know, that whole space. Through pregnancy, prenatal, you know, antenatal, all the way to vaccination, you know. So that whole process is now available on a digital platform. How have you looked at it? And do you have any suggestions on what is available and what you think we can improve? Do you have any?
Yeah. Another suggestion is that, you know, in the where I did my rural assessment is in Chuluni Health Center, Kitui.
Yes.
Now in Chuluni, we don't have that system. We find mothers and the mothers cannot deliver there. Now we find bridging the misinformation about SHA, it's a problem, it's a challenge. You tell a mother register for SHA, then she starts asking you as a healthcare worker a lot of questions. And then I'm supposed to give help, I'm supposed to give the information.
The service,
I'm supposed to give the service and the information and everything. Now to bridge that gap, now we have the app, and also at the comfort of her home, she's able to receive messages, timely messages, reminding her.
So you're saying this can enhance what is there.
Yeah, what is there.
You can provide the last mile.
Yeah.
Great.
And that is information.
Let me come in. I am the owner of the system. we have, what you have explained, we have one better.
Yes.
And you can use your phones, everybody here. It's called Afya Yangu app. Afya Yangu app is for the patient. You don't carry your MRI, you don't carry, it is paperless. So you go to your doctor, for example, all the stages, the journey of a maternal is found on Afya Yangu. For the doctor, we have Practice 360. And that's why even a doctor can use that app to give the authorization, OTP. So I know the problem you have in Churu, in Kitui, is because we have only done 25 counties digitization. But Kitui is one of the counties we have not gone to. The moment we take our tablets, we take our biometrics, no Kenyan will carry.
How will those gadgets help her as a health professional to assist the patient?
Now that gadget does registration, has the patient's data, the doctor uses for authorization, and that gadget, in fact, even if you steal it, we tell Kenyans, even if you steal it, it won't help you. It has been scripted in such a way that it only carries health data.
Now, but I think to her point, the mother, how will the mother in the village? Because the tablet is available in the hospital.
Yes.
What about the mother in the village? I think that is what she
That's
said.
why, if the mother has a phone, She uses the Afya Yangu.
Oh, they can log in.
Yes, even from anywhere, even you. If you go and upload Afya Yangu, your details, your share number.
Is it available on USSD like us?
Absolutely. And then,
so maybe
there's one question which we need to answer.
Yeah.
So there's only one group of people in Kenya who don't have a smartphone. They even don't have a medical visa. So how do we help them? And that's why we have got 107,000 community health promoters.
Maybe the health promoters can use it.
Yes, every village, they go to every household and they'll ask you.
Okay. So I think you have a partnership we can create.
But for that person to invest, going forward, all the health system must be integrated into the digital health superhighway.
Yeah.
This is a very good system they have provided.
Okay, please.
Okay. My name is Edison Mondo.
Yes.
I am a student undertaking Bachelor in Computer Science.
Very good.
Doing a specification in software engineering.
Okay.
It is a pleasure to meet you, sir.
Thank you very much, my friend.
So I hereby present you a decentralized housing registration system. This particular system works on a blockchain technology. I'm targeting the affordable housing program, where each and every Kenyan should embrace this particular program. So how does it work? We are bringing safe and secure registration and secure transfer of entitlement, which is ownership among these beneficiaries, using secure platform and using smart contracts in this particular platform. So how does it work? How do I ensure safe registration? I am using a hierarchy from a super admin to an admin to the owner. So a super admin registers an admin using the wallet address. And now the admin registers an owner and the property details too using the owner's address. Now, after the owner is registered, they can access their user dashboard and the property which is registered to that particular owner under their own wallet address. This wallet address is provided in the blockchain technology, are unique and therefore safe and secure. Now, on the transfer of entitlement pattern, when an owner, the property listed under his own wallet address wants to list this particular property, and other owners can obtain this property. One, they list it on the marketplace, it is available. The second user will now see this particular property, request for buy, and now the request is pending, and therefore the first owner is going to accept this request. Now he's willing to transfer this particular project. After transfer, as you can see, the first owner's account, there is no property because it has been transferred. It is a smart contract that has been executed, and therefore on the second owner, he has now two properties. If you can see the property number, it is the same as the one the first owner had.
The one which was on sale.
Yeah, the one which was on sale. Yeah. So we have this each and every action on this particular system has a gas. Reason because I'm using Ethereum as a particular blockchain and cryptocurrency. Now, each and every transaction, this actually means that this particular system, once it has been integrated within the system, it can actually generate revenue. These are the accounts. These are the wallet addresses that have been used in this particular prototype, and these are the smart contracts that have been executed in this particular prototype. So, sir, will you join me to make a happy nation?
I certainly will. The way I see your system, the way it is configured, it's again a last mile product, to assist us in the sale of the houses, and because we want to democratize and make that place transparent so that people can see, you make the offer available to everybody. Because the system we have today is if you go to *832# that is Bomayangu, then I would want you to think, I want you to go to Bomayangu, I think it is *832#, you check what is available on Bomayangu, and then tell us what improvements you think can be made in that space. Because we are now moving to the next level. More units are now available to the public to buy. And therefore this system, which is the system for, it's like an agency system, it will now come into play. That now it is the process of identifying the buyers. And we have an algorithm that makes sure that you can only buy a house once. You cannot buy another house until everybody in Kenya has bought one. So that, because that's the logic of affordable housing or social housing. And also because we want to also create equity, right? And every buyer is going to be assessed. The people with the lowest ability come first, so that we can be able to deal with the people in the more vulnerable people in that space, especially for social housing. And then we have affordable housing. And then we have also available for people who want to buy market rate houses. So I would want you to think about, log into Bomayangu, look at it and suggest to us any improvement we can make from there. Would you do that?
I will do that, certainly.
Yeah? So, good luck. Yeah.